Good morning, respected dignitaries. I'm Mrs. Sime Chacko, first year MSc Nursing student. Would like to present my research proposal today before you. Okay, a feasibility study, comparative evaluation of clinical breast examination versus iBreast tool device in screening women for early detection of breast cancer at TMH and ACTRAC. Background of my study, effective screening programs are the best way to detect cancer before experiencing any symptoms. Study at TMH is the largest which has given evidence of decreased mortality by use of CBE in women over 50 years. Breast cancer screening methods include breast self-examination, clinical breast examination, and mammograms or USG breast. Diagnostic delays can occur due to patients' absenteeism or healthcare providers' incompetency. The goal of early diagnosis program is to provide education, training, and curative treatment. Breast cancer is on the rise globally. In 2020, there were 3 million women who were with breast cancer and 685,000 deaths globally. Women in low and middle income countries are often diagnosed with breast cancer at an advanced stage when treatment needs are most intensive and costly and outcomes are poor. Diagnosis of breast cancer at early stages can result in improved outcomes when followed with timely and appropriate treatment. CBE may be a suitable option for countries in economic transition, whereas incidence rates are on the increase, but limited resources do not permit screening by mammography. In Mumbai, India, the incidence of breast cancer has risen by nearly 40% between 1992 and 2016. Breast cancer is the leading cause of death in women in most states of India. Early recognition of symptoms and accurate diagnosis of breast cancer can result in diagnosis and earlier stages of progression, at which point treatment is more likely to be feasible, affordable, and effective. The iBreast exam device was introduced and received the US Food and Drug Administration approval in 2013 as a tool for documenting clinical findings in the breast. Its piezoelectric finger technology measures differences in breast tissue stiffness using tactile palpation from the skin surface. The Wilson criteria for screening Wilson's criteria for screening state that a screening test should accurately identify a high proportion of patients with early disease. The present study is therefore designed to comparatively evaluate iBreast tool with CBE. The primary objective for my study to compare the outcomes of examination to CBE by trained nurses, and the secondary objective to estimate the safety, feasibility, and accuracy of CBE and iBreast exam device in women for early detection of breast cancer in relation to sensitivity and specificity. The sample size and power justification, primary endpoint of study is to compare outcome of iBreast device examination with CBE. The previous study shows a sensitivity of 33% and specificity as 73%. The prevalence of disease is 10% with 0.05 precision. Total sample size of 370 achieves a 90% power to detect the change in specificity using specificity test, and the target significance level is 0.05, including 10% of dropout. My research approach would be evaluative. The research design, interventional single arm, sample size 370, population women about 30 years, sample, women staff working at TMH and ACTRAC Hospital in Mumbai, and sampling technique would be a convenient sampling. The inclusion and exclusion criteria, the inclusion criteria would be women about 30 years of age working at TMH and ACTRAC Mumbai Hospital who will give their consent, and exclusion criteria, pregnant or lactating women and women with history of cancer. Setting would be at TMH and ACTRAC. This is about the clinical breast examination. And the methodology would be selection of the participant to inclusion and exclusion criteria, obtaining informed consent and enrolling the participant. CBE would be by trainers, IB examination by trainers blinded to CBE, and CBE would be done finally by the doctor, and the true positive cases would be referred for further investigations. The iBreast tool is a piezoelectric finger technology, measures differences in breast tissue stiffness using a tactile palpation from the skin surface. The device is paired with a Bluetooth with its associated tablet, 1 minute, once paired. Calibrate the device with against air, 10 seconds, then calibrate it by placing it on the breast tissue for 10 seconds. The iBreast exam or the IBE consists of a handheld compression probe containing a 4x4 array of piezoelectric tactile pressure sensors, a custom-built electronic board, and a tablet. IBE communicates wirelessly with the mobile device to display and store the findings in real time. Using IB results for screening in the interventional group will be displayed in a 4x4 pressure array map of the breast on the tablet. Areas of green indicate normal tissue, while any area of red indicates a detected lesion. The IB does not characterize the type of lesion detected. compression data are recorded as a unique file at the end of every scan to the mobile device, which is synced to an encrypted database via Dropbox, where a copy is saved. A green pressure array map on IB will be classified as negative, whereas any area of red pressure array on the IB map will be classified as a positive exam. Absence of a palpable lesions on CB will be classified as negative.
Sorry to interrupt you.
Yes, sir.
Kindly summarize, please, because
yes, sure,
5 minutes are over.
Yes, sure. What is more, conclusion is breast cancer screening by mammography reduces mortality in women aged 50 and older. Breast self-examination has not been proven to be an effective method for early detection of breast cancer, but screening by clinical breast examination can reduce mortality from breast cancer. It's not known. What this present study can add is can improve the screening through training and reference. And with that, I conclude with my study, sir. Thank you so much.